All right, let's dive right in. Have you ever heard the term positive punishment? I mean, it sounds like a total oxymoron, doesn't it? How on earth can punishment be, well, positive? It turns out that name is super misleading if you're not in the know, and that's exactly what we're going to untangle today. So before we go any further, just chew on this for a second. What if positive, in this very specific world, had absolutely nothing to do with being good or pleasant? What if it meant something completely different? Just keep that question in the back of your mind as we go.
Okay, so that question, it really gets right to the heart of all the confusion. So our first stop is to untangle the clinical meaning of positive punishment. Because, in behavioral science, a bit like in, say, physics or math, words are used with this incredible precision. And their everyday meanings, they just don't always cut it.
Okay, so here's the breakdown. In our everyday language, positive means good, desirable, something we like. But clinically, it just means adding a stimulus. Think of a plus sign in math. It's about addition. And punishment, it's not about revenge or a penalty. It's simply a consequence that makes a behavior decrease. So when you put them together, positive punishment is not good punishment. It's the addition of a consequence that makes a behavior happen less often.
All right, so we've cracked the code on the name. It makes sense now, right? But what does this stuff actually look like in practice? Let's get into the specifics of the different procedures. So first up, we have reprimands, basically scolding. And this is something we're all familiar with. It seems pretty straightforward, but here's the catch, and it's a big one. It can totally backfire. See, if the attention from the scolding is the only attention a person is getting, that attention can actually end up reinforcing the behavior. It's a classic case of unintended consequences. Then there's something called response blocking. This is a very direct, hands-on intervention. It's used when a behavior is physically harmful, like, say, self-biting. The idea is to physically stop the behavior as it's happening. By doing that, you're preventing the sensory reinforcement that comes from the action itself. You're breaking that feedback loop.
Moving on, we have response, interruption, and redirection, or RIRD for short. This one is designed for those repetitive behaviors that can really get in the way of learning. In this case, the added consequence is the interruption. You step in, break the repetitive cycle, and then guide the person toward a safer, more appropriate action.
So it's a pretty straightforward two-step process. First, you interrupt the repetitive motor or vocal behavior. Then, step 2, you immediately redirect the person to do something else they already know how to do, like clapping their hands or answering a simple question. It's all about breaking that cycle and shifting their focus.
And then there's a technique called overcorrection, which actually comes in two different types. First, you have restitutional overcorrection. The idea here is that you have to restore the environment and then some. So in the example here, if a person writes on one desk, they have to clean that desk and the other desks in the room. Then there's positive practice. This is where you repeatedly practice the right alternative behavior. So if you come inside with muddy shoes, you don't just clean them once, you have to practice the whole routine of wiping your shoes on the mat again and again. Okay, so we've looked at the how, we understand the techniques, but every intervention, and I mean especially one that involves punishment, comes with potential baggage. And this brings us to, honestly, the most important question of all: what are the hidden costs? And this is where we get to the most crucial part of this whole conversation: the unintended side effects. We absolutely cannot talk about these procedures without exploring the significant, and I mean really significant risks that come along with them. And we're not talking about minor issues here. These are serious potential outcomes. We're talking about things like aggression, escape, or avoidance behaviors, like lying or cheating to get out of the situation. Sometimes the behavior just pops up somewhere else, even worse than before. It can also model undesired behavior for other people. And there's a really subtle danger too. It can be reinforcing for the person doing the punishing, which can lead to overuse.
And I really want to pause on this specific quote from the source material because it's so powerful. The authors, Cooper, Heron, and Heward, warn that the person may engage in behavior far worse than the behavior being addressed. Let that sink in. The solution could create an even bigger problem. That's a really profound and sobering warning.
So, given how serious these risks are, you can imagine there have to be some incredibly strict guardrails in place. And there are. This brings us to our final section, the ethical rules of engagement. These are the absolute non-negotiables that are put in place to protect the client. And it all starts with these foundational client rights. You're looking at the right to safety, the right to humane treatment, and the right to treatments that are actually effective. But the big one here, the one that governs everything, is the right to the least restrictive procedures first. You don't just jump to punishment. It has to be the absolute last resort, only after reinforcement-based approaches have been exhausted.
And this responsibility doesn't just fall on one person's shoulders. It's systemic. Agencies themselves must have very clear policies in place to make sure clients are safe, and they have to follow all the professional, local, and state guidelines. It's about building safety into the very fabric of the organization.
And so this really leaves us with a final, lingering question, one that sits at the very heart of this entire topic. Is a treatment truly effective if it isn't humane? It's a question that forces us to weigh outcomes against ethics, and it's absolutely the essential consideration when navigating the complex and, let's be honest, often controversial world of positive punishment.